Medical Assistant Exam Air Documentation Questions. Question 1. At the start of care in an administrative check-in area, a patient has an advance directive in the chart. Which statement is most accurate? Option A. It is used only to schedule appointments. Option B. It communicates the patient's wishes about future medical care. Option C. It allows the assistant to ignore provider orders. Option D. It replaces all insurance forms. The correct answer is option B. It communicates the patient's wishes about future medical care. An advance directive helps guide care decisions if the patient cannot speak for themselves. Scheduling is unrelated to the purpose of an advance directive. Care decisions still follow legal, clinical, and facility processes. Advance directives do not replace billing or insurance documents. Question 2. For a patient encounter in a diagnostic testing area, a chain of custody urine drug screen is collected. Which practice is most important? Option A. Skip signatures if the specimen looks normal. Option B. Allow the patient to take the specimen home first. Option C. Use an unlabeled container until the lab receives it. Option D. Document each transfer and maintain specimen integrity. The correct answer is option D. Document each transfer and maintain specimen integrity. Chain of custody documents who handled the specimen from collection through testing. Appearance does not replace custody documentation. Uncontrolled possession breaks specimen integrity. Unlabeled specimens can be rejected and cannot be reliably traced. Question 3. Following office protocol in a medication administration visit, a voicemail must be left for a patient according to office policy. Which message is safest? Option A. Demand payment details with full medical history. Option B. Describe the diagnosis in detail on the message. Option C. Leave another patient's results for comparison. Option D. Leave limited information and a callback number. The correct answer is option D. Leave limited information and a callback number. Limited voicemail content reduces the risk of exposing health information to others. Excessive information violates privacy and may not be necessary. Detailed clinical information may be heard by unauthorized people. Sharing another patient's information is a privacy breach. Question 4. Following office protocol in a medication administration visit, a patient with known latex allergy is scheduled for a procedure. Which preparation is best? Option A. Use latex-free supplies and clearly communicate the allergy. Option B. Ignore the allergy if the procedure is short. Option C. Use powdered latex gloves because they are easier to put on. Option D. Tell the patient to bring personal gloves only. The correct answer is option A. Use latex-free supplies and clearly communicate the allergy. Avoiding latex exposure prevents allergic reactions and keeps the team aware of the risk. Even brief latex exposure can cause a serious reaction. Latex gloves can trigger a reaction in a latex allergic patient. The clinic remains responsible for preparing a safe care environment. Question 5. As part of exam preparation in a patient intake station, the term dermatology appears in a referral. Which specialty is involved? Option A. Blood. Option B. Heart. Option C. Kidney. Option D. Skin. The correct answer is option D. Skin. Dermatology is the specialty focused on skin conditions. Hematology focuses on blood and blood disorders. Cardiology focuses on the heart. Nephrology focuses on the kidneys. Question 6. While working in a community health clinic, a patient asks about wound care instructions after a minor procedure. Which response is best? Option A. Review the provider-approved instructions and confirm understanding. Option B. Tell the patient not to call if symptoms worsen. Option C. Avoid documenting that instructions were given. Option D. Create new instructions that contradict the provider. The correct answer is option A. Review the provider-approved instructions and confirm understanding. Medical assistants can reinforce approved instructions and use teach-back to verify understanding. Patients should know when and how to seek help for concerning symptoms. Patient education should be documented according to policy. Instructions should match the provider's plan and office protocol. Question 7. In a family practice clinic, the assistant needs to keep provider meeting time unavailable for patient appointments. Which scheduling tool is useful? Option A. Matrix blocking. Option B. Sterile field setup. Option C. Order of draw. Option D. Coinsurance posting. The correct answer is option A. Matrix blocking. Matrix blocking reserves time in the schedule for meetings, procedures, or other unavailable periods. Sterile field setup supports clinical procedures, not schedule blocking. Order of draw guides blood collection sequence. Coinsurance posting relates to patient financial responsibility. Question 8. While working in an outpatient laboratory, a multi-dose vial has no date after being opened. Which action is most appropriate? Option A. Follow facility policy and do not use it if safety cannot be verified. Option B. Mix it with another vial to avoid waste. Option C. Use it because the cap is still attached. Option D. Guess the opening date from memory. The correct answer is option A. Follow facility policy and do not use it if safety cannot be verified. Opened multi-dose vials require proper dating and storage to support medication safety. Combining vials can contaminate medication and is not appropriate. The cap does not prove when the vial was opened or whether it was stored correctly. Guessing creates unsafe documentation. Question 9. During a primary care office, a patient calls with chest pain and shortness of breath. Which scheduling action is most appropriate? Option A. Tell the patient to send an email later. Option B. Follow emergency triage protocol immediately. Option C. Give a diagnosis over the phone. Option D. Schedule the patient for next month. The correct answer is option B. Follow emergency triage protocol immediately. Potential emergency symptoms should be handled urgently according to office protocol rather than scheduled as routine. Potential emergencies require immediate action. Medical assistance should not diagnose the cause of symptoms. Routine scheduling can delay care for potentially serious symptoms. Question 10. As part of exam preparation in a women's health clinic, a urine culture is ordered for a patient who can void independently. Which collection method is most appropriate? Option A. First drops of urine into an unclean container. Option B. Specimen collected from the toilet bowl. Option C. A random sample from an old urinal. Option D. Clean catch midstream specimen. The correct answer is option D. Clean catch midstream specimen. A clean catch midstream specimen helps reduce contamination from skin or genital flora. Initial urine can carry contaminants and an unclean container is inappropriate. Toilet water contaminates the specimen. Old specimens may be contaminated and may not reflect current results. Question 11. When a patient encounter unfolds in a pediatric clinic, a venipuncture site is cleansed with alcohol before collection. Which action helps prevent hemolysis and discomfort? Option A. Allow the alcohol to dry completely. Option B. Blow on the site to speed drying. Option C. Touch the vein again with an ungloved finger. Option D. Draw blood while alcohol is still wet. The correct answer is option A. Allow the alcohol to dry completely. Letting alcohol dry reduces stinging and helps avoid contamination or hemolysis from wet alcohol. Blowing can contaminate the cleansed site. Palpating after cleaning can contaminate the site unless proper technique is used. Wet alcohol can sting and may affect specimen quality. Question 12. An office review in a primary care office shows that a patient reports feeling dizzy after standing quickly. Which immediate action reduces fall risk? Option A. Assist the patient to sit or lie down safely. Option B. Ask the patient to walk faster. Option C. Leave the patient standing while searching for forms. Option D. Tell the patient dizziness is impossible. The correct answer is option A. Assist the patient to sit or lie down safely. Helping the patient into a safe position reduces the chance of injury from fainting or falling. Walking can increase fall risk when the patient is dizzy. An unsteady patient should not be left unsupported. Dismissing symptoms does not protect patient safety. Question 13. In an exam room, the term tachypnea appears on an intake form. Which meaning is correct? Option A. Low temperature. Option B. Rapid breathing. Option C. Slow pulse. Option D. Painful urination. The correct answer is option B. Rapid breathing. Tachy means fast, and near relates to breathing. Low temperature is hypothermia. Slow pulse is bradycardia. Painful urination is dysuria. Question 14. Before the visit continues in an electronic health record review, a fax containing patient information must be sent to another facility. Which step reduces privacy risk? Option A. Verify the recipient fax number before sending. Option B. Leave the fax confirmation on a public counter. Option C, send it to a number from memory without checking. Option D, include unrelated patient charts in the same fax. The correct answer is option A. Verify the recipient fax number before sending. Verifying the destination helps prevent disclosure to the wrong recipient. Confirmation pages may contain protected information and should be handled securely. Memory errors can lead to misdirected protected information. Only necessary information should be disclosed. Question 15. For a patient encounter in a family practice clinic, a patient asks for a copy of their medical record. Which action should the assistant take? Option A, delete sensitive information before the request is reviewed. Option B, refuse because records belong only to the provider. Option C, give the record to anyone who asks. Option D, follow the office release of information process. The correct answer is option D. Follow the office release of information process. Patients generally have rights to access their records, but the request must follow proper identity and release procedures. Altering the record is inappropriate and may violate legal requirements. Patients have rights to access their health information under applicable rules. Identity and authorization must be verified before disclosure. Question 16. After reviewing the situation in a treatment room, the assistant reviews the normal pacemaker of the heart. Which structure is identified? Option A, alveolus. Option B, sinoatrial node. Option C, gallbladder. Option D, ureter. The correct answer is option B, sinoatrial node. The sinoatrial node normally initiates the heart's electrical impulse. An alveolus is a lung air sac. The gallbladder stores bile and is not cardiac conduction tissue. A ureter carries urine from kidney to bladder. Question 17. A medical assistant is working in an infection control audit when a medical assistant prepares to administer an injection. Which set best represents medication rights? Option A, right diagnosis only. Option B, right insurance, right copay, right appointment, and right room. Option C, right color of vial and right storage shelf. Option D, right patient, right medication, right dose, right route, right time, and right documentation. The correct answer is option D, right patient, right medication, right dose, right route, right time, and right documentation. The medication rights are safety checks used to prevent administration errors. Diagnosis alone is not enough to confirm safe administration. Administrative details do not replace medication safety checks. Vial appearance and shelf location are not sufficient medication rights. Question 18. During an outpatient laboratory, a patient signs permission after the provider explains a procedure's risks, benefits, and alternatives. Which concept is demonstrated? Option A, battery. Option B, informed consent. Option C, implied consent. Option D, abandonment. The correct answer is option B, informed consent. Informed consent occurs when a patient agrees after receiving enough information to make a voluntary decision. Battery involves unauthorized touching or treatment. Implied consent is inferred from actions such as extending an arm for a blood draw. Abandonment involves ending care without appropriate notice. Question 19. Given the workflow in a same-day appointment, a patient collapses in the hallway and is unresponsive. Which action should be taken first? Option A, activate emergency response and assess breathing according to training. Option B, finish documenting the previous visit. Option C, move the patient to a chair before assessing. Option D, offer water by mouth immediately. The correct answer is option A, activate emergency response and assess breathing according to training. An unresponsive patient requires immediate emergency response and basic life support actions within training. Documentation should not delay emergency care. Unnecessary movement can cause injury and delay assessment. Giving oral fluids to an unresponsive patient risks aspiration. Question 20. For a patient encounter in a same-day appointment, a patient arrives for a routine visit and appears anxious about the first blood pressure reading. Which communication technique should the medical assistant use? Option A, promise that the provider will not be concerned. Option B, acknowledge the concern and explain the procedure in simple terms. Option C, ignore the anxiety to avoid making it worse. Option D, tell the patient the reading is probably wrong. The correct answer is option B, acknowledge the concern and explain the procedure in simple terms. Acknowledging emotion and explaining the task supports trust while keeping the patient informed. Promising an outcome goes beyond the assistant role and may be inaccurate. Ignoring patient concerns can increase anxiety and weaken communication. Dismissing the result can reduce confidence and may be clinically misleading. Question 21. Before the visit continues in a medical office workflow, a patient pays a fixed amount at the time of an office visit. Which insurance term applies? Option A, copayment. Option B, adjustment. Option C, premium. Option D, deductible. The correct answer is option A, copayment. A copayment is a fixed amount the patient pays for a covered service. An adjustment changes the billed amount based on contracts or corrections. A premium is the amount paid to maintain insurance coverage. A deductible is the amount the patient pays before insurance begins paying according to the plan. Question 22. A medical assistant is working in a same-day appointment when the assistant removes soiled dressings from a wound. Which practice is appropriate? Option A, place the dressing on the clean supply tray. Option B, handle the dressing with bare hands. Option C, save the dressing in the patient's purse. Option D, use gloves and dispose of the dressing according to biohazard policy. The correct answer is option D, use gloves and dispose of the dressing according to biohazard policy. Soiled dressings can contain blood or body fluids and require barrier protection and proper disposal. Soiled material can contaminate clean supplies. Bare hand contact increases exposure risk. Biohazard waste should not be sent home in personal belongings. Question 23. An office review in an exam room shows that a coworker asks to view a neighbor's chart out of curiosity. Which response is appropriate? Option A, open the chart if the coworker promises not to tell anyone. Option B, deny the request because there is no job-related need to know. Option C, share the chart because staff work in the same clinic. Option D, print the chart and remove the patient's name only. The correct answer is option B, deny the request because there is no job-related need to know. Access to protected health information must be limited to legitimate work-related purposes. A promise does not create a permitted reason for access. Employment at the same clinic does not automatically authorize chart access. De-identified information must meet specific standards and curiosity is not permitted access. Question 24. During a patient education session, a small fire starts in a trash can at the clinic. Which acronym guides the initial fire response? Option A, SOAP. Option B, PRN. Option C, RACE. Option D, NPO. The correct answer is option C, RACE. RACE stands for Rescue, Alarm, Contain, and Extinguish or Evacuate depending on policy. SOAP is a documentation format and does not guide fire response. PRN means is needed and does not guide emergency fire response. NPO means nothing by mouth and is unrelated to fire safety. Question 25. While working in a clinical skills review, the term otitis media is listed in the assessment. Which body area is involved? Option A, stomach. Option B, liver. Option C, middle ear. Option D, kidney. The correct answer is option C, middle ear. Otitis media refers to inflammation or infection involving the middle ear. Stomach inflammation is gastritis. Liver inflammation is hepatitis. Kidney inflammation is related to nephritis or pyelonephritis. Question 26. The care team in an internal medicine office asks for guidance because a patient is placed lying flat on the back for an abdominal exam. Which position is being used? Option A, supine. Option B, prone. Option C, Fowler. Option D, Sims. The correct answer is option A, supine. Supine means lying on the back facing upward. Prone means lying face down. Fowler position is seated or semi-seated. Sims position is side-lying with one knee flexed. Question 27. The care team in a specialty referral visit asks for guidance because a student asks which blood component helps with clotting. Which answer is correct? Option A, alveoli. Option B, plasma glucose. Option C, neurons. Option D, platelets. The correct answer is option D, platelets. Platelets help form clots and support hemostasis. Alveoli are lung structures involved in gas exchange. Glucose is a blood sugar and does not form clots. Neurons transmit nerve signals and are not blood clotting cells. Question 28. An office review in an administrative check-in area shows that a package of sterile instruments has an expired sterilization date under office policy. Which action is appropriate? Option A, open the package and rinse the instruments. Option B, reprocess the instruments before use. Option C, use the instruments if the package is dry. Option D, write a new date on the package. The correct answer is option B, reprocess the instruments before use. Expired or compromised sterile items should not be used until they are properly reprocessed. Rinsing does not restore sterility. A dry package alone does not override an expiration policy. Changing the date without reprocessing is unsafe and misleading. Question 29. In a diagnostic testing area, a pulse oximeter is placed on a cold finger and the reading is inconsistent. Which action should be tried first? Option A, warm the finger or choose a better perfused site. Option B, ignore the waveform and record the lowest value. Option C, increase oxygen without reporting the finding. Option D, place the probe over wet nail polish. The correct answer is option A, warm the finger or choose a better perfused site. Poor peripheral perfusion can make pulse oximetry readings unreliable. An unstable signal should be corrected before documenting the value. Medication or oxygen changes should follow provider direction and clinical protocol. Moisture and polish can interfere with sensor performance. Question 30. The care team in a women's health clinic asks for guidance because the assistant reviews where bile is stored before release into the small intestine. Which organ stores bile? Option A, bladder. Option B, spleen. Option C, pancreas. Option D, gallbladder. The correct answer is option D, gallbladder. The gallbladder stores and concentrates bile made by the liver. The urinary bladder stores urine, not bile. The spleen is involved in immune and blood cell functions. The pancreas produces digestive enzymes and hormones but does not store bile. Question 31. During an urgent care office, the term bradycardia appears in the chart. Which meaning should the medical assistant recognize? Option A, inflammation of the liver. Option B, high blood sugar. Option C, fast breathing. Option D, slow heart rate. The correct answer is option D, slow heart rate. The prefix brady means slow, and cardia refers to the heart. Inflammation of the liver is hepatitis. High blood sugar is hyperglycemia. Fast breathing is tachypnea rather than bradycardia. Question 32. The care team in a diagnostic testing area asks for guidance because coordination of benefits is needed. Which situation does this usually involve? Option A, a provider orders a throat swab. Option B, a patient has one cash payment only. Option C, a patient needs a sterile dressing. Option D, a patient has more than one insurance plan. The correct answer is option D, a patient has more than one insurance plan. Coordination of benefits determines how multiple plans share payment responsibility. A throat swab order does not itself involve multiple insurance plans. One cash payment does not require multiple plan coordination. Dressing supplies do not create coordination of benefits by themselves. Question 33. After reviewing the situation in a certification exam scenario, the office schedules several patients at the start of each hour and sees them as rooms open. Which scheduling method is being used? Option A, matrix blocking. Option B, stream scheduling. Option C, prior authorization. Option D, wave scheduling. The correct answer is option D, wave scheduling. Wave scheduling brings patients in at set intervals such as the start of an hour. Matrix blocking reserves time unavailable for patient appointments. Stream scheduling assigns patients specific individual appointment times. Prior authorization is payer approval and is not a scheduling method. Question 34. As part of exam preparation in an administrative check-in area, a provider documents a vaccine administration. Which coding information may be needed for billing? Option A, procedure code and diagnosis or reason for the service. Option B, only the assistant's initials with no service information. Option C, only the room number. Option D, only the patient's favorite color. The correct answer is option A, procedure code and diagnosis or reason for the service. Claims often require a service code and a diagnosis or reason to support medical necessity. Initials alone do not provide billing codes or medical necessity. Room numbers do not describe the service or diagnosis. Personal preferences do not support claim coding. Question 35. Before the visit continues in a family practice clinic, a wet floor is noticed near the reception desk. Which action best prevents injury? Option A. Place a warning sign and arrange cleanup immediately. Option B. Wait until a patient reports slipping. Option C. Cover it with loose papers. Option D. Ignore it because it is not in an exam room. The correct answer is option A. Place a warning sign and arrange cleanup immediately. Prompt warning and cleanup reduce slip and fall risk. Prevention should occur before an injury happens. Loose paper can worsen slipping and does not clean the hazard. Safety hazards matter throughout the facility. Question 36. While working in a procedure setup, the provider asks for an instrument to examine the retina. Which instrument should be prepared? Option A. Ophthalmoscope. Option B. Reflex hammer. Option C. Otoscope. Option D. Centrifuge. The correct answer is option A. Ophthalmoscope. An ophthalmoscope is used to view internal eye structures such as the retina. A reflex hammer tests reflexes and does not visualize the retina. An otoscope is used for the ear canal and tympanic membrane. A centrifuge separates specimen components and is not an eye exam tool. Question 37. Before the visit continues in a patient intake station, a serum sample is needed for a routine chemistry test. Which tube type may be used according to facility protocol? Option A. Lavender EDTA tube for serum. Option B. Light blue citrate tube for serum. Option C. A red or gold serum tube. Option D. Gray fluoride tube for all serum tests. The correct answer is option C. Red or gold serum tube. Serum tubes allow clotting or include clot activator and separator depending on the tube. EDTA prevents clotting and produces whole blood or plasma, not serum. Citrate anticoagulant is used for coagulation testing. Gray tubes are not the standard serum tube for routine chemistry panels. Question 38. After reviewing the situation in an outpatient laboratory, a tickler file is used in the office. Which purpose does it serve? Option A. Sterilize instruments. Option B. Draw blood into tubes. Option C. Measure oxygen saturation. Option D. Track future follow-ups or reminders. The correct answer is option D. Track future follow-ups or reminders. A tickler system helps staff remember time-sensitive tasks or future actions. Sterilization requires approved equipment and process. Blood collection uses phlebotomy supplies, not a reminder file. Oxygen saturation requires a pulse oximeter. Question 39. A medical assistant is working in a specialty referral visit when a patient has a minor nosebleed while waiting. Which first aid instruction is commonly appropriate? Option A. Pack the nose with contaminated gauze. Option B. Sit upright and lean slightly forward. Option C. Tilt the head far backward. Option D. Lie flat immediately without assessment. The correct answer is option B. Sit upright and lean slightly forward. Leaning forward helps reduce swallowing blood while upright posture can reduce pressure. Contaminated materials should not be inserted into the nose. Tilting backward can cause blood to drain into the throat. Lying flat can increase swallowing of blood and is not the usual first step for a simple nosebleed. Question 40. At the start of care in a preventive care visit, a medical assistant discusses a patient's diagnosis in a crowded elevator. Which rule is being violated? Option A. Prior authorization. Option B. Chain of custody. Option C. Patient confidentiality. Option D. Sterile technique. The correct answer is option C. Patient confidentiality. Discussing identifiable health information in a public area can expose confidential information. Prior authorization concerns payer approval for services. Chain of custody concerns specimen handling documentation, not public conversations. Sterile technique concerns preventing contamination during procedures. Question 41. The care team in a primary care office asks for guidance because the assistant prepares instruments for suture removal. Which item is commonly needed? Option A. Tuning fork only. Option B. Suture removal scissors or sterile scissors according to policy. Option C. Peak flow meter only. Option D. Ophthalmoscope only. The correct answer is option B. Suture removal scissors or sterile scissors according to policy. Suture removal requires an appropriate cutting instrument and aseptic supplies according to the procedure. A tuning fork may be used in hearing or vibration tests. A peak flow meter measures expiratory airflow and does not remove sutures. An ophthalmoscope is used to examine the eye, not remove sutures. Question 42. For a patient encounter in a certification exam scenario, the term nephrology appears in a referral. Which specialty is involved? Option A, eyes. Option B, kidneys. Option C, ears. Option D, bones. The correct answer is option B, kidneys. Nephrology is the specialty focused on kidney function and disease. Ophthalmology focuses on eyes. Otolaryngology focuses on ear, nose, and throat conditions. Orthopedics focuses on the musculoskeletal system. Question 43. Before the visit continues in an infection control audit, an adult patient has a blood pressure reading much higher than previous visits. Which action should the medical assistant take? Option A, send the patient home to rest without notifying anyone. Option B, tell the patient that hypertension has been diagnosed. Option C, erase the value because it may worry the patient. Option D, recheck using proper technique and report the finding according to protocol. The correct answer is option D, recheck using proper technique and report the finding according to protocol. Unexpected or significantly abnormal vital signs should be verified and communicated to the provider. Abnormal readings require appropriate follow-up rather than dismissal. Medical assistants do not diagnose conditions based on one reading. Accurate documentation is required even when the value is abnormal. Question 44. After reviewing the situation in an infection control audit, a patient says they feel chest pressure while the electrocardiogram is being prepared. Which action should the medical assistant take? Option A, tell the patient it is probably anxiety. Option B, notify the provider immediately and follow emergency protocol. Option C, complete all paperwork before telling anyone. Option D, ask the patient to drive to another clinic. The correct answer is option B, notify the provider immediately and follow emergency protocol. Chest pressure may indicate a serious condition and requires prompt clinical attention. Medical assistants should not diagnose the cause of chest pressure. Administrative tasks should not delay reporting possible cardiac symptoms. Potential cardiac symptoms should be handled through established emergency procedures. Question 45. While working in a medical office workflow, a pain score is being collected during intake. Which approach is best? Option A, assume pain level from facial expression only. Option B, change the score to match the assistant's opinion. Option C, ask the patient to rate pain using the office's standard scale. Option D, tell the patient pain is not part of vital signs. The correct answer is option C, ask the patient to rate pain using the office's standard scale. Using a consistent pain scale helps document subjective pain in a comparable way. Facial expression alone may not reflect the patient's reported pain. The pain score should reflect the patient's report. Pain assessment is commonly included in intake workflows. Question 46. Before the visit continues in a clinical skills review, a sterile dressing change is being prepared. Which action helps maintain sterility? Option A, open sterile supplies without touching the inner sterile surface. Option B, reach across the field with unsterile clothing. Option C, reuse sterile gloves from a previous patient. Option D, place sterile gauze on an unclean counter. The correct answer is option A, open sterile supplies without touching the inner sterile surface. Avoiding contact with sterile surfaces helps preserve the sterile field. Reaching over the field can contaminate it. Sterile gloves are single-use and patient-specific. An unclean surface contaminates sterile supplies. Question 47. In a walk-in clinic, the assistant scans a signed consent form into the wrong patient's chart. Which action is best? Option A, ask the patient to sign a blank form. Option B, delete the form and tell no one. Option C, report and correct the filing error according to policy. Option D, leave it because both patients use the same clinic. The correct answer is option C, report and correct the filing error according to policy. Misfiled records can affect patient care and privacy, so they must be corrected properly. Blank forms do not correct the misfiled record and are inappropriate. Unreported deletion can worsen the documentation error. Clinic use does not make one patient's document appropriate in another chart. Question 48. To protect safety in a patient education session, a patient requests an appointment reminder by text message. Which consideration is important? Option A, follow office policy and patient communication preferences. Option B, text any diagnosis to any phone number in the chart. Option C, post the reminder on social media. Option D, ignore all reminder preferences. The correct answer is option A. Follow office policy and patient communication preferences. Electronic reminders should follow privacy policy and documented preferences. Sensitive information and wrong numbers can create privacy risk. Public posting would expose private information. Preferences help guide appropriate communication. Question 49. An office review in a patient intake station shows that a patient makes a complaint about care received in the office. Which response is most professional? Option A, argue until the patient stops complaining. Option B, listen respectfully and follow the office complaint process. Option C, delete documentation related to the complaint. Option D, post the complaint online for staff opinions. The correct answer is option B. Listen respectfully and follow the office complaint process. A respectful response and proper reporting support patient relations and quality improvement. Arguing escalates conflict and is unprofessional. Destroying or altering records is unethical and may be illegal. Publicly sharing patient concerns can violate confidentiality. Question 50. Before the visit continues in an internal medicine office, an order reads amoxicillin 500 mg by mouth. Which abbreviation matches the route? Option A, 4. Option B, IM. Option C, subcut. Option D, PA. The correct answer is option D, PA. PA means by mouth and is used for oral administration. 4 means intravenous and refers to administration into a vein. IM means intramuscular and refers to injection into muscle. Subcut means subcutaneous and refers to injection into tissue under the skin. Question 51. A medical assistant is working in a walk-in clinic when a provider needs the head of the exam table raised for a patient with breathing difficulty. Which position may be helpful? Option A, prone position. Option B, Trendelenburg is the only routine choice. Option C, Fowler position. Option D, lithotomy position. The correct answer is option C, Fowler position. Fowler position raises the head and upper body, which can ease breathing for some patients. Prone places the patient face down and may worsen breathing comfort. Trendelenburg lowers the head and is not the usual comfort position for breathing difficulty. Lithotomy is used for pelvic procedures and does not primarily support breathing. Question 52. In an outpatient laboratory, the term dysuria is documented in the chief complaint. Which symptom does it describe? Option A, excessive thirst. Option B, difficulty swallowing. Option C, ear inflammation. Option D, painful or difficult urination. The correct answer is option D, painful or difficult urination. Dysuria refers to pain or difficulty with urination. Excessive thirst is polydipsia. Difficulty swallowing is dysphagia. Ear inflammation is otitis. Question 53. A medical assistant is working in a diagnostic testing area when a minor arrives without a parent for a non-urgent visit. Which action is best? Option A, assume all minors can consent to every service. Option B, ask another patient in the waiting room to consent. Option C, follow state law and office policy for consent requirements. Option D, refuse all care without considering exceptions. The correct answer is option C, follow state law and office policy for consent requirements. Consent rules for minors vary by situation and jurisdiction, so policy must be followed. Minor consent is not universal for all services. Other patients cannot provide consent for the minor. Some laws allow minors to consent for certain services. Question 54. Following office protocol in a clinical skills review, a new patient calls to schedule an annual physical. Which information should be collected for registration? Option A, demographics, contact information, insurance information, and reason for visit. Option B, the assistant's diagnosis before the visit. Option C, only the patient's favorite pharmacy color. Option D, another patient's insurance card. The correct answer is option A, demographics, contact information, insurance information, and reason for visit. Complete registration information supports scheduling, billing, and clinical preparation. The assistant should not diagnose during scheduling. That information does not complete registration. Insurance information must belong to the patient being registered. Question 55. Before the visit continues in an urgent care office, A medical office uses a policy and procedure manual. Which purpose is most accurate? Option A, eliminate the need for training. Option B, guarantee every claim is paid. Option C, provide standardized guidance for office tasks. Option D, replace all state laws. The correct answer is option C, provide standardized guidance for office tasks. Policies and procedures help staff perform tasks consistently and safely. Policies support but do not replace staff training. Policies do not guarantee pay or reimbursement. Office policy cannot override applicable law. Question 56. Given the workflow in a family practice clinic, a claim requires the code for an office visit procedure or service. Which code set is used? Option A, zip code. Option B, policy number. Option C, ICD-10-CM. Option D, CPT. The correct answer is option D, CPT. CPT codes describe medical procedures and professional services. A zip code identifies location and is not a procedure code. A policy number identifies insurance coverage and does not describe the service. ICD-10-CM codes describe diagnoses and reasons for services. Question 57. Following office protocol in a patient intake station, the provider is running behind and a patient asks for an update. Which response is professional? Option A, tell the patient that waiting is their only option. Option B, guarantee an exact time even when it is unknown. Option C, apologize for the delay and provide the best available estimate. Option D, discuss another patient's emergency as the reason. The correct answer is option C, apologize for the delay and provide the best available estimate. Clear and courteous updates help manage expectations without blaming others. Dismissive communication is unprofessional. False certainty can create more frustration. Sharing another patient's situation can violate privacy. Question 58. An office review in an urgent care office shows that a patient states that the listed pharmacy is no longer used. Which action best supports accurate care coordination? Option A, leave the old pharmacy because it is already in the chart. Option B, choose the pharmacy closest to the clinic. Option C, update the preferred pharmacy after verifying the new information. Option D, delete all pharmacy information from the record. The correct answer is option C, update the preferred pharmacy after verifying the new information. Current pharmacy information helps prescriptions and refills reach the correct location. Outdated demographic information can delay medication access. The preferred pharmacy should come from the patient rather than staff convenience. Removing needed information can interrupt prescribing workflows. Question 59. Following office protocol in a pediatric clinic, a used needle must be discarded after an injection. Which practice is safest? Option A, recap the needle with both hands. Option B, carry the needle to the front desk for disposal. Option C, place the needle in regular trash. Option D, activate the safety device and place the needle in a sharps container. The correct answer is option D, activate the safety device and place the needle in a sharps container. Sharps should be secured and discarded immediately in a puncture-resistant sharps container. Two-handed recapping increases needle stick risk. Transporting exposed sharps through the office increases risk. Sharps can injure staff and must not go into regular trash. Question 60. When a patient encounter unfolds in a pediatric clinic, a patient has chest hair that prevents electrodes from adhering. Which action is most appropriate? Option A, place electrodes over clothing. Option B, prepare the skin according to protocol to improve electrode contact. Option C, ignore loose electrodes if the tracing prints. Option D, wet the electrodes with tap water only. The correct answer is option B, prepare the skin according to protocol to improve electrode contact. Good skin preparation helps electrodes adhere and improves tracing quality. Electrodes must contact skin to record electrical activity. Loose electrodes can create artifact and poor quality results. Unapproved moisture does not replace proper skin preparation. Question 61. When a patient encounter unfolds in a phlebotomy station, a patient is left without follow-up after the provider terminates care without proper notice. Which legal issue is most likely? Option A, coinsurance. Option B, default. Option C, beneficence. Option D, abandonment. The correct answer is option D, abandonment. Abandonment occurs when care is ended without proper notice or an opportunity to obtain continuing care. Coinsurance is a payment-sharing insurance term. Assault is a threat or fear of unwanted touching, not failure to provide follow-up. Beneficence means acting for the patient's good. Question 62. Given the workflow in a primary care office, soap and water are required instead of alcohol sanitizer after caring for a patient with suspected Clostridioides difficile. Which reason explains this requirement? Option A. Soap and water help remove spores more effectively from the hands. Option B. Alcohol sanitizer is always illegal in clinics. Option C. Gloves completely replace hand hygiene. Option D. Hand washing is needed only before eating. The correct answer is option A. Soap and water help remove spores more effectively from the hands. Certain spores are not reliably eliminated by alcohol-based hand rubs, so mechanical washing is important. Alcohol-based hand rubs are appropriate for many routine situations. Gloves reduce exposure but do not replace hand hygiene after removal. Hand hygiene is required at multiple points in patient care. Question 63. When a patient encounter unfolds in a pediatric clinic, the endocrine system is being reviewed. Which gland produces thyroid hormone? Option A. Gallbladder. Option B. Urinary bladder. Option C. Thyroid gland. Option D. Appendix. The correct answer is option C. Thyroid gland. The thyroid gland produces hormones that help regulate metabolism. The gallbladder stores bile and is not an endocrine gland producing thyroid hormone. The urinary bladder stores urine and does not produce thyroid hormone. The appendix does not produce thyroid hormone. Question 64. Following office protocol in a women's health clinic, a patient is crying after receiving difficult news from the provider. Which nonverbal behavior is supportive? Option A. Laugh to lighten the mood immediately. Option B. Keep checking messages during the conversation. Option C. Stand over the patient with crossed arms. Option D. Sit at eye level and allow silence when appropriate. The correct answer is option D. Sit at eye level and allow silence when appropriate. Calm presence, appropriate eye level, and respectful silence can support a distressed patient. Humor can be inappropriate when a patient is distressed. Distracted behavior suggests the patient is not being heard. Closed posture and standing over the patient can seem intimidating. Question 65. Given the workflow in an internal medicine office, a patient must pay a percentage of the allowed charge after the deductible is met. Which term applies? Option A. Copayment. Option B. Remittance address. Option C. Referral. Option D. Coinsurance. The correct answer is option D. Coinsurance. Coinsurance is the patient's percentage share of covered costs. A copayment is usually a fixed amount rather than a percentage. A remittance address tells where payments or documents are sent. A referral is permission or direction to see another provider. Question 66. A medical assistant is working in a same-day appointment when the assistant reinforces instructions for a Holter monitor. Which point is important? Option A. Submerge the monitor in water. Option B. Remove electrodes whenever symptoms occur. Option C. Ignore the return time. Option D. Keep a diary of symptoms and activities as instructed. The correct answer is option D. Keep a diary of symptoms and activities as instructed. A symptom and activity diary helps correlate events with the recorded rhythm. Water can damage the device and create safety risks. Removing electrodes can interrupt recording when data are most important. The monitor must be returned as scheduled for data review. Question 67. Given the workflow in an internal medicine office, a staff member shares an electronic health record password to save time. Which risk is created? Option A. Automatic insurance approval. Option B. Better sterilization monitoring. Option C. Loss of accountability for chart access. Option D. Improved privacy protection. The correct answer is option C. Loss of accountability for chart access. Unique logins support audit trails and show who accessed or changed information. Passwords do not control payer authorization. Login credentials do not sterilize instruments. Password sharing weakens privacy and security. Question 68. At the start of care in a preventive care visit, an insurance plan requires approval before a specialist visit. Which process is being described? Option A. Autoclaving. Option B. Venipuncture. Option C. Prior authorization or referral process. Option D. Auscultation. The correct answer is option C. Prior authorization or referral process. Some plans require authorization or referral before certain services are covered. Autoclaving sterilizes instruments and is unrelated to payer approval. Venipuncture is blood collection and does not authorize insurance coverage. Auscultation is listening to body sounds and does not approve visits. Question 69. To protect safety in a clinical skills review, a patient arrives at check-in and the waiting room can overhear the conversation. Which practice protects privacy? Option A. State the full diagnosis loudly to confirm the visit. Option B. Speak quietly and avoid announcing sensitive details. Option C. Ask other patients to help verify the record. Option D. Place all charts open on the counter. The correct answer is option B. Speak quietly and avoid announcing sensitive details. Front office privacy requires limiting unnecessary disclosure where others may overhear. Announcing diagnoses in public can violate confidentiality. Other patients should not be involved in private verification. Open charts may expose protected information. Question 70. In an outpatient laboratory, the office wants to place 2 short follow-up visits in the same time slot according to policy. Which scheduling method is being used? Option A. Wave scheduling. Option B. Open hours. Option C. Clustering. Option D. Double booking. The correct answer is option D. Double booking. Double booking places more than one patient in the same appointment slot. Wave scheduling schedules several patients to arrive at the beginning of a block. Open hours allow patients to arrive without exact appointment times. Clustering groups similar types of appointments together. Question 71. As part of exam preparation in a cardiology practice, a patient asks the medical assistant to interpret laboratory results. Which response is within scope? Option A. Tell the patient the provider will review and explain the results. Option B. Post the result publicly so others can comment. Option C. Change the results so it appears normal. Option D. Diagnose the patient based on abnormal values. The correct answer is option A. Tell the patient the provider will review and explain the results. Interpreting results and giving diagnostic meaning are provider responsibilities. Public disclosure violates confidentiality and professionalism. Changing results is unethical and falsifies the record. Diagnosis is outside the medical assistant scope of practice. Question 72. For a patient encounter in a quality control review, a patient wants information released to a spouse. Which documentation is usually needed? Option A. No documentation because spouses always have full access. Option B. A valid authorization or permission according to office policy. Option C. A verbal request from the spouse only. Option D. A note written by the assistant after the fact. The correct answer is option B. A valid authorization or permission according to office policy. Disclosure to another person should follow privacy rules and documented patient permission. Relationship alone does not automatically grant full access to records. The spouse's request alone may not authorize release. Authorization should come from the patient or legal authority. Question 73. After reviewing the situation in a women's health clinic, a blood specimen must be mixed with additive after collection. Which technique is appropriate? Option A. Open the tube and stir with a swab. Option B. Leave the tube unmixed until pickup. Option C. Gently invert the tube the required number of times. Option D. Shake the tube forcefully. The correct answer is option C. Gently invert the tube the required number of times. Gentle inversion mixes blood with additive without causing unnecessary cell damage. Opening the tube can contaminate the specimen and expose staph. Failure to mix may cause clotting or poor specimen quality. Forceful shaking can cause hemolysis and inaccurate results. Question 74. During a busy front office, the assistant removes gloves after contact with blood-contaminated gauze. Which action should follow immediately? Option A. Use the same gloves to clean the next room. Option B. Place the gloves in a regular drawer. Option C. Apply lotion instead of cleaning hands. Option D. Perform hand hygiene. The correct answer is option D. Perform hand hygiene. Hand hygiene after glove removal reduces the chance of transmitting microorganisms from contaminated gloves. Gloves are task-specific and should not be reused between patients or areas. Used gloves are contaminated waste and should be discarded properly. Lotion does not replace hand hygiene. Question 75. An office review in a women's health clinic shows that a mistake is found in an electronic progress note after it was signed. Which correction method is appropriate? Option A, ignore the error even if it affects care. Option B, make an addendum according to office policy. Option C, ask a coworker to change it under their login. Option D, delete the original note completely. The correct answer is option B, make an addendum according to office policy. An addendum preserves the original entry while documenting the correction transparently. Clinically important errors should be corrected through proper procedures. Using another person's login violates accountability. Deleting a signed record can destroy the audit trail. Question 76. During a walk-in clinic, blood spills on an exam room floor. Which response follows standard safety practice? Option A, ask a patient to avoid stepping on it. Option B, cover the spill with an exam table paper. Option C, wipe the spill with a dry paper towel only. Option D, use appropriate personal protective equipment and an approved disinfectant. The correct answer is option D, use appropriate personal protective equipment and an approved disinfectant. Blood spills require barrier protection and a disinfectant suitable for bloodborne pathogen cleanup. Patients should not be involved in hazardous cleanup. Covering a spill does not remove or disinfect the hazard. Dry wiping can spread contamination and does not disinfect the surface. Question 77. During a family practice clinic, the assistant uses a fire extinguisher on a small contained fire. Which acronym describes extinguisher use? Option A, PERLA. Option B, HIPAA. Option C, PASS. Option D, ARICE. The correct answer is option C, PASS. PASS stands for pull, aim, squeeze, and sweep. PERLA describes pupil assessment. HIPAA governs health information privacy and security. RICE refers to rest, ice, compression, and elevation for certain injuries. Question 78. Given the workflow in a women's health clinic, a patient receives a document explaining what the insurer paid and what may be owed. Which document is this? Option A, progress note. Option B, sterilization log. Option C, advance directive. Option D, explanation of benefits. The correct answer is option D, explanation of benefits. An explanation of benefits summarizes payer processing, allowed amounts, payments, and patient responsibility. A progress note documents clinical care, not insurance payment decisions. A sterilization log tracks instrument processing, not claim payment. An advance directive communicates future care wishes, not payment information. Question 79. At the start of care in a pediatric clinic, the abbreviation PRN appears on a medication list. Which meaning should be recognized? Option A, immediately. Option B, every morning. Option C, by mouth. Option D, as needed. The correct answer is option D, as needed. PRN means the medication is taken as needed according to the order. Immediately is stat in common medical usage. Every morning is commonly abbreviated differently and is not PRN. By mouth is PA. Question 80. Following office protocol in a preventive care visit, a coworker posts a patient's unusual injury story on social media without a name but with enough details to identify the patient. Which issue is most concerning? Option A, appropriate marketing. Option B, breach of confidentiality. Option C, quality control testing. Option D, routine scheduling. The correct answer is option B, breach of confidentiality. Identifiable health details can violate privacy even if the patient's name is omitted. Using patient information for entertainment or marketing requires strict authorization and is not appropriate here. Quality control relates to test system accuracy, not social media disclosure. Scheduling does not involve posting private health information publicly. Question 81. Following office protocol in a primary care office, a subpoena for medical records arrives at the office. Which response is best? Option A, ask the receptionist to summarize the chart from memory. Option B, give it to the provider or designated privacy officer for proper handling. Option C, ignore it because subpoenas never apply to clinics. Option D, immediately fax the entire chart without review. The correct answer is option B, give it to the provider or designated privacy officer for proper handling. Legal requests for records should be reviewed through office policy before information is released. Summaries from memory are unreliable and not an appropriate legal response. Subpoenas can require action and should not be ignored. Records should not be released without verifying legal requirements and scope. Question 82. To protect safety in a pediatric clinic, the term gastroenterology appears in a referral. Which specialty is involved? Option A, digestive system. Option B, endocrine glands. Option C, nervous system. Option D, urinary bladder only. The correct answer is option A, digestive system. Gastroenterology focuses on the digestive tract and related disorders. Endocrinology focuses on hormone-producing glands. Neurology focuses on the nervous system. Urology focuses on the urinary tract and male reproductive system. Question 83. An office review in a medical office workflow shows that office supplies are consistently running out before the next order date. Which administrative action is best? Option A, track usage and adjust par levels according to office needs. Option B, hide supplies from the provider. Option C, wait until every item is completely gone. Option D, order random supplies without reviewing use. The correct answer is option A, track usage and adjust par levels according to office needs. Inventory control uses usage patterns and reorder points to prevent shortages. Hiding supplies does not solve inventory management. Waiting can interrupt patient care and office workflow. Unplanned ordering can waste money and storage space. Question 84. Given the workflow in a specialty referral visit, an electronic record uses an audit trail. What is its purpose? Option A, measure blood pressure. Option B, approve insurance claims instantly. Option C, sterilize instruments automatically. Option D, track who accessed or changed information. The correct answer is option D, track who accessed or changed information. Audit trails support accountability by recording user activity in the record. Vital sign measurement requires clinical equipment and technique. Payer claims processing is separate from record audit logs. Audit trails do not process instruments. Question 85. A medical assistant is working in an outpatient laboratory when a claim is denied because patient insurance information was outdated. Which front office process helps prevent this issue? Option A, skip registration for returning patients forever. Option B, code every visit as preventive care. Option C, verify insurance eligibility at each visit according to policy. Option D, use the oldest card in the file without asking. The correct answer is option C, verify insurance eligibility at each visit according to policy. Eligibility verification helps identify coverage changes before claims are submitted. Returning patients can have changed insurance or contact information. Coding must reflect the service and documentation. Old cards may no longer reflect active coverage. Question 86. Given the workflow in a same-day appointment, a capillary puncture is needed on an adult finger. Which site is generally preferred? Option A, the tip of the index finger. Option B, the little finger near the bone. Option C, the center of the thumb pad. Option D, the side of the middle or ring finger pad. The correct answer is option D, the side of the middle or ring finger pad. The lateral side of the middle or ring finger pad helps avoid bone and sensitive central tissue. The index finger is commonly used for touch and may be more sensitive or calloused. The little finger has less tissue over bone and is usually avoided. The thumb is often calloused and has a pulse, making it less preferred. Question 87. Following office protocol in a same-day appointment, a medical assistant performs a procedure without patient permission. Which legal concern may apply? Option A, coordination of benefits. Option B, defamation. Option C, battery. Option D, emancipation. The correct answer is option C, battery. Battery can involve intentional touching or treatment without consent. Coordination of benefits is an insurance concept. Defamation involves false statements that harm reputation. Emancipation relates to a minor's legal independence. Question 88. In a procedure setup, the date of birth in the chart does not match the date of birth stated by the patient. Which response best protects patient safety? Option A, use the appointment time as the identifier. Option B, continue if the last name matches. Option C, correct the date of birth without asking anyone. Option D is stop and resolve the discrepancy before proceeding with care. The correct answer is option D, stop and resolve the discrepancy before proceeding with care. A mismatch in identifiers must be clarified before treatment, specimen collection, or documentation continues. Appointment times are scheduling data and are not approved identifiers. A last name alone does not rule out an identity error. Changing demographic data without verification may create a documentation error. Question 89. For a patient encounter in a telephone triage workflow, the provider asks for the chief complaint before entering the room. Which documentation is most appropriate? Option A. Patient seems dramatic about ear pain. Option B. Right ear normal after exam. Option C. Patient reports sharp right ear pain for 2 days. Option D. Ear infection diagnosed today. The correct answer is option C. Patient reports sharp right ear pain for 2 days. The chief complaint should be documented as the patient's main reason for the visit in clear, concise wording. Subjective judgment is unprofessional and not appropriate for the medical record. Exam findings belong to the provider and are not the chief complaint. A diagnosis should not be documented by the assistant unless the provider has made it. Question 90. For a patient encounter in a busy front office, a patient asks the assistant whether to stop taking a prescribed medication. Which response is appropriate? Option A. Tell the patient to stop immediately. Option B. Refer the question to the provider. Option C. Recommend doubling the dose instead. Option D. Suggest using a friend's medication. The correct answer is option B. Refer the question to the provider. Medication changes require provider guidance because stopping therapy can be unsafe. Directing medication discontinuation is outside the assistant role. Changing a dose without provider order is unsafe and outside scope. Sharing medication is unsafe and inappropriate. Question 91. A medical assistant is working in an infection control audit when the provider asks the assistant to perform a task prohibited by state law. Which action is appropriate? Option A. Clarify the concern and follow legal scope of practice requirements. Option B. Document that the patient requested it and proceed. Option C. Ask another assistant to do it secretly. Option D. Perform it because any provider request is automatically legal. The correct answer is option A. Clarify the concern and follow legal scope of practice requirements. Medical assistants must follow laws, regulations, and employer policy even when working under delegation. Patient request does not override scope of practice limits. Passing on an improper task does not resolve the legal issue. Delegation does not make a prohibited task legal. Question 92. An office review in a treatment room shows that a centrifuge is used in the laboratory. Which safety practice is important? Option A. Place only one tube at any weight in the rotor. Option B. Open the lid while it is spinning. Option C. Stop the rotor with a hand. Option D. Balance tubes before starting the centrifuge. The correct answer is option D. Balance tubes before starting the centrifuge. Balancing tubes helps prevent vibration, breakage, and equipment damage. Unbalanced loads can damage the machine or specimens. Opening a spinning centrifuge is unsafe. Stopping a rotor manually is dangerous. Question 93. Given the workflow in an urgent care office, a specimen label is missing after collection. Which action is best? Option A. Follow facility policy for recollection or correction without guessing. Option B. Send the tube with no label and explain later. Option C. Ask another patient if the tube belongs to them. Option D. Write a name on the tube from memory. The correct answer is option A. Follow facility policy for recollection or correction without guessing. Unlabeled specimens create patient identification risk and must be managed according to policy. Laboratories commonly reject unlabeled specimens. Patients cannot resolve specimen identity errors reliably. Guessing can cause a serious misidentification error. Question 94. When a patient encounter unfolds in a clinical skills review, an adult patient declines a procedure after the provider explains the risks and benefits. Which principle is being respected? Option A. Beneficence. Option B. Abandonment. Option C. Patient autonomy. Option D. Respondeat superior. The correct answer is option C. Patient autonomy. Autonomy means a competent patient has the right to make informed decisions about care. Beneficence means acting for the patient's good but does not override a competent refusal. Abandonment involves ending care without proper notice or support. Respondeat superior concerns employer responsibility for employee actions. Question 95. After reviewing the situation in an exam room, a claim requires the code that explains why a service was performed. Which code set is used? Option A, NDC only. Option B, CPT. Option C, ICD-10-CM. Option D, place of service only. The correct answer is option C, ICD-10-CM. ICD-10-CM codes report diagnoses and reasons for services. National drug codes identify medications and do not describe diagnoses. CPT codes report procedures and services rather than diagnoses. Place of service identifies setting, not the medical reason for care. Question 96. A medical assistant is working in a specialty referral visit when a complete blood count is ordered. Which tube is most commonly used? Option A, red tube with no anticoagulant. Option B, light blue tube with sodium citrate. Option C, gray tube with fluoride oxalate. Option D, lavender tube with EDTA. The correct answer is option D, lavender tube with EDTA. A complete blood count requires anticoagulated whole blood, and EDTA in a lavender tube preserves cell morphology. A red tube allows clotting and is not the standard choice for a complete blood count. Sodium citrate is used mainly for coagulation studies. Gray tubes are used for tests such as glucose or lactate depending on protocol. Question 97. For a patient encounter in a medication administration visit, a medical assistant leaves a computer screen open with patient information visible. Which safeguard would help prevent this issue? Option A, lock the workstation before stepping away. Option B, disable audit trails to speed workflow. Option C, share passwords with trusted co-workers. Option D, keep the screen facing the waiting room. The correct answer is option A, lock the workstation before stepping away. Locking the workstation protects electronic protected health information from unauthorized viewing. Audit trails support security monitoring and should not be disabled by staff. Shared passwords weaken accountability and violate security practices. Visible screens increase privacy risk. Question 98. An office review in a patient education session shows that the assistant documents a patient's statement in the medical record. Which entry is most appropriate? Option A, patient states, I have had a cough for 3 days. Option B, no documentation is needed for symptoms. Option C, the assistant diagnoses pneumonia. Option D, patient is definitely exaggerating the cough. The correct answer is option A, patient states, I have had a cough for 3 days. Quoting or clearly attributing patient statements helps distinguish subjective information from clinical findings. Symptoms are relevant to the visit and should be documented according to policy. Diagnosis belongs to the provider. Judgmental wording is inappropriate and not objective. Question 99. In a community health clinic, a patient from a different cultural background describes a health practice unfamiliar to the assistant. Which response is most appropriate? Option A, tell the patient the practice is foolish. Option B, assume all people from that culture act the same. Option C, refuse to document relevant information. Option D, ask respectful questions and avoid judgment. The correct answer is option D, ask respectful questions and avoid judgment. Culturally sensitive communication explores patient beliefs while maintaining respect. Judgmental language damages trust and may prevent disclosure. Stereotyping ignores individual differences. Relevant patient information should be documented according to policy. Question 100. Before the visit continues in a medication administration visit, a patient needs crutch walking education after provider instruction. Which principle is important? Option A, body weight should rest mainly on the armpits. Option B, crutches should fit properly and not press into the axilla. Option C, crutches should be used only on wet floors. Option D, the patient should skip follow-up if pain increases. The correct answer is option B, crutches should fit properly and not press into the axilla. Improper crutch fit can compress nerves and blood vessels in the axilla. Weight should be supported through the hands, not the axilla. Crutches are mobility aids and wet floors increase fall risk. Worsening symptoms should be reported according to instructions.